Good afternoon and welcome to this edition of Finweek Money Matters. Do remember this is the show that helps you manage your finances. I'm Demisha Greater. Coming up on the show today, we'll be taking a closer look at predictive medicine. That's an interesting medical procedure in which genetic screen testing is used to determine the risk of genetic disorders. And then technical analyst Mushima Gama shares her outlook for fashion retailer Foschini, or that is true, it's to be more correct. And will this current strategy that particular company is faced with work? Later on, I'll be with a panel of experts. We'll be discussing the sinking mining sector and if they can find a way forward. So lots to get through today, but do remember that we want to hear from you. So send us your feedback. You can send it through to moneymatters@abn360.com. But first, let's take a look at the trend of the week. Predictive medicine in the form of genetic testing has been available in South Africa for years. While now, new kid on the block, Salubrity, has partnered with Swiss-based clinical diagnostic company Genoma, and they'll be bringing in 2 generic screen testing products. They claim they are non-invasive, and that is compared to the standard tests, and they can also deliver quick results. The one test screens a number of chromosomal disorders in unborn babies, while the other determines the risk for breast and ovarian cancer. Well, in studio to tell us more about the launch of these genetic screening services is Dr. Hendrik Hanekom, Chief Executive and Co-founder of Intercare Group. Thank you so much for making the time to join us, Doctor. I've said a mouthful and I'm hearing that it's got to do with testing, where you can find things out. Maybe take us back and help us understand exactly what this testing is and how is it different from what we currently have in the market out there.
Demisha, thank you very much, first of all, for the invitation, and also for the opportunity to share with you a little bit what we are doing, some exciting work we are doing within the Intercare Group, which actually currently consists of 16 medical and dental centers, 4 subacute rehab hospitals and 4 day hospitals around the country. Genetic testing is actually, just one of the pillars of a newly established company called Salubrity. It's part of the Intercare Group. Now, Salubrity is a knowledge-based risk management company that actually focus on health as such. And the purpose of Salubrity is to enable healthcare, to make good healthcare possible. So we focus on a few things: disease management, we focus on individual wellness, we focus on corporate wellness, and then genetic testing. Okay,
so this genetic testing for a person like me, if I was coming in, what exactly would happen? So how does it work? I know there are others out there, so it's stated in the introduction, but what's different here?
Well, I think first of all, we are launching 2 tests, and I think you can also see it here. There are Tranquility, the one, and Serenity. Now, Serenity, let's start with Serenity. It's actually a screening test for breast cancer.
Okay.
And then Tranquility is actually a screening test for chromosomal disorders in the fetus. Let's start with the breast cancer one. Breast cancer is the most common cancer in women in South Africa. 1 in 29 women in South Africa will develop breast cancer. However, the sooner you detect it, the higher the better the outcomes, the chances for recovering. So what we are doing with Serenity is actually screening for 2 specific genes, and look for mutations in those genes, and those are BRCA1 and BRCA2. And if there are mutations, the risk is there for breast cancer. Okay,
so you look for these mutations, and it says it's non-invasive.
So it's non-invasive. Can I just say, I think the nice thing about this is just a simple, on the Serenity test is actually a simple swab that you actually can just do in the inside of the mouth.
Okay, so that is just hold up the container for us, Doctor. A lot of us, we don't know what that is. Is it a test tube of sorts that you've got
actually,
there?
Unfortunately, inside the pack, we don't want to break the pack here.
All right. But it's actually the clear tubes there in front of you.
So these are the test tubes for blood test for the next one. But for the Serenity one, it's actually a very simple just a swab that you actually take in the inside of the mouth,
And
send it away,
and you get your results.
and you
How
get the
quick,
results.
How quick do you get your results?
2 weeks.
2 weeks.
Yes.
Versus, is this a
Well, it can-
quick turnaround? A quick turnaround
This
period?
is a
here?
quite a quick turnaround because many of the other tests are also sometimes sent to the United States, but
Okay.
I think this is quite a quick turnaround.
And how are you a candidate for something like this? So if I want to test for breast cancer, should there be certain prerequisites before I'm able to do so with these particular products?
Yeah, I think with all of these tests, first of all, if there's a family history, of breast cancer or ovarian cancer, can I also make this is not only for breast cancer, it's also ovarian cancer. So if there's a family history, or if there are some, if you have some disorders in some other family members, and then very important is also some ethnic groups like the Afrikaner women and Ashkenazi Jews. They have a much higher risk for breast cancer. So in those instances, it's very important actually to have the test.
How much does this cost, and is it available if I go to, how do I get a hold of this?
Well, first of all, we are launching 1st of March.
Okay.
It will be available initially from the Intercare Medical and Dental Centres, and the cost of this is around about 9,250 Rand. Now, hopefully with time,
It'll be
the cost will come down, like with any technology, the cost will come down. But the unfortunate thing for us also in South Africa, we have the Rand Euro, situation.
exactly.
So we hope we can actually continue doing it for that.
Doctor, thank you so much for coming in this afternoon and telling us about this new innovation. 2 weeks, around 9,000 Rand, and there are a couple of things to keep in mind, especially if you do have a family history. Thank you so much to Dr. Hendrik Hanekom, a Chief Executive and Co-founder of Intercare Group. Coming up, let's take a look at this week's Killer Trade.